Yes, you have heard the elegant talk by Professor Pande. It was full of information and very new to us. He has dealt with several examples of heterogeneity of the tumors, aggressiveness, mild behavior, examples of American College of Cardiologists. And in our scenario, probably we cannot practice because of the legal issues and research involved in it till we have genomic chips with the patients. I cannot dream about that. He has taught the role of genetics too much about it. In our country, probably the personalized medicine may not be appropriate to be practiced with. Since it is a new subject and new term, I would request to put few questions to Professor Pande, if you feel like. Yeah, our remarks. Yes, sir, please.
Thank you very much, Professor Pande, for an excellent talk. I think there are two ways of treating a patient. Ultimately, whatever research or academics is, it boils down to giving a better care to the patient. One is we treat the disease in a patient. Other is we treat the patient in disease. In that case, we treat the disease in respect of that patient, his circumstances, his genetic genes, and also his financial status. In my opinion, I don't question the definition of personalized medicine which you have given. But in my opinion, personalized medicine is medicine in respect to a particular person or a particular patient, treating him of his disease, due investigations, keeping in mind his physical condition, otherwise anemia, etc., deficiencies, his circumstances in the particular patient.
Thank you, sir. Very good. I agree with all the comments that you made. I totally agree. Yeah. Yeah, there is.
Want to comment?
Yeah.
No comments?
So I want to ask that as you have told us about the personalized medicine according to you, the genomics and all, so in our country, as you have said that after 10 years or so, we would able to see that personalized and that genome card and all. So do you think that in our country where people are suffering from poverty, education, they're all suffering, and we are thinking that after 10 years or so, can this be dream also? According to me, as sir has said that it's a far distant dream. According to me, first, sir, I just want to know that what you think about it. That can we, means I don't think.
The question that you have asked me is very pertinent, and if I have understood you correctly, you have asked me whether the genomic medicine will take care of the malnutrition and the inequity which exists in this country. The answer is no.
Yes.
We need to alleviate poverty, we need to look after the nutrition of the people. Genomic medicine is not going to be helpful at all in taking away these evils that are present in our society.
Yes, please.
Dr. Sharma, actually it is not confined to cancer now that you have to do the genomic profile. In dermatology there is a disease psoriasis. In psoriasis already which biological to use may be in future decided by the genetic makeup of the patient. So it will come. Of course, psoriasis is also a proliferative disease, but not a cancer. So it will come.
Yeah.
And how soon? The things can change very fast. I want to reassure my young colleague here. The things change faster than you think. India has changed in last 10 years so much, we probably could not imagine. Maybe in next 10 years this will be true. It may not be the dream. Thank you.
Dr. Sanjeev.
Thank you.
For a very
A very informative lecture. So besides personalized medicine, I think we're also going towards personalized surgery. Because I think surgery started as a personalized thing because you do tailor your surgery according to the patient's all the points that Dr. Sandhu raised. But I think the genomics, when it's coming into it, it has made a difference, and people are looking at personalized surgery. And the cost and the role it plays, sir. Take the example of cancer like breast cancer. Drugs for estrogen receptor and progesterone receptor positive breast cancer. The first thing which came was tamoxifen. You get that thing for 2 rupees. That's also personalized medicine. Because if positive you will give, negative you will not give. So the cost and what the future holds and how fast the cost is going to come down, it's very difficult to comprehend, but I'm sure, sir, it's going to come down. Herceptin from 1,25,000 is down to 30,000 rupees. So as they use and as more of the things, sure it's going to come down.
Thank you very much, and I apologize for the omission of not including the surgical aspects of the personalized medicine. This is again something which has already come up. You don't have the knee replacement without the computerized configuration of the joint and tailor-made artificial devices. This is true, and this is going to be practiced more and more often. Sure.
Last comment, Professor Churamani.
Yeah, I would only like to comment with a note of positive note that things which look to be really expensive today, with the use and with our own ingenious things coming up. Once we, in our own country, we do have the intelligence to manufacture things, and once we have indigenized things coming up for the masses, cost will certainly come down.
Sure, sure. Thank you, Dr. Churamani. The problem is the intellectual property rights. They are posing a lot of hurdle. Otherwise, the cost of all these tests can be 1/10 or 1/20 of what it is today.
Well, thank you, sir. But I can cite few examples, particularly from neurosurgery. There are tumors which were treated homogeneously in entire population, but with the addition of genes, deletions, and the kind of genetic markers have evolved the system where one patient behave in a different manner and that patient behave quite in different manner, and different kinds of chemotherapies are chosen. So probably in days to come we are seeing the future of such a medicine. Thank you very much. It was very informative. And
Thank you, Dr. Rajkumar, and I am aware of your work on glioblastoma. Thank you.
Thank you, Dr.